So the first group of people, so what we are talking about is the statins benefit group. How do I know? And I've explained it here, which one is high intensity statin, moderate intensity, and low intensity. And I said that the high intensity is your RA. Some people remember it as AR or RA. So what is that RA? The Atorvastatin and Rosuvastatin. Then if you look at the low intensity, there is no RA in the low intensity. So sometimes in the exam, they can ask you a question. All of the following are low intensity statin, except, and you will see options like Simvastatin, Pravastatin, Lovastatin, and they will go and add Atorvastatin. So Atorvastatin is the one that is out because it's not in low intensity. Then the moderate intensity is everything in high intensity and everything in low intensity, plus depending on the dosage. So the dosage is the only thing that differs. For example, Atorvastatin is 80 mg. In moderate, it is 20 mg. Then now another frequently asked question is, how do I know if I will give low intensity, high intensity, moderate intensity? And that is the statins benefit group. And it's under four categories. So the first category is what we call clinical ASCVD. So this clinical ASCVD, they are example people that have like heart attack, stroke, any of those peripheral artery disease. What is the guideline? The guideline say that those people have to be on high intensity. So that is to tell you anybody that have this, which American Heart Association considered as a clinical ASCVD. So they have to be on high intensity. So that means you are going to give them Rosuvastatin or Atorvastatin. Remember, there are four groups. So we go to the second group. So the second group is the group. So the second group is the group that the LDL, which is the bad cholesterol. The LDL is greater than or minus greater than 190. So that means the LDL is too high. Remember that the LDL, we don't want it to be more than 100, but it is greater than 190. So for these people, you have to give them high intensity. Again, you are giving them high intensity. So that high intensity is your Rosuvastatin or Atorvastatin. Then we have another group. So in that group now, we say people that have diabetes and they are 40 years to 45 years. So let's say they are between 40 to 75 years and they are diabetic. So those people, we can give them moderate to high. So it does not matter. You can give them the high one or the moderate one. So if you are giving them Atorvastatin or Rosuvastatin, then you have to look at the dosage. Like we said, the dosage of Atorvastatin, if it is a high one, you are going to give them 80. But if it is a moderate one, you are going to give them 20. If it's Rosuvastatin, we are going to give them 40. Then if it is Rosuvastatin in moderate, you are going to give them 10. So that is the people that are, those are the third group. Then the last group, but not the least, these people, we say that they don't have any of those, they don't have their age is between 40 to 75, and they have a 10-year ASCVD risk. So this is the primary prevention risk based group. So you can now calculate the statin And at this point, you can give them, they can benefit from high to moderate. So that is the, because remember, these people are between 40 years, sorry, to 45. Their LDL is high, but then they have a 10 years, so they have a 10 years ASCVD risk. So there's risk, possible risk that they may develop all those heart problem in the future. So what else do we need to remember? Just a summary. The group 1 people, high intensity. The group 2 people, high intensity. The group 3 people, high to moderate. Then to group 4 people, high to moderate. So this is the summary of what we have. So you can see it, high intensity. So you, that is the summary. So basically, you are giving the group 1 high intensity, group 2 high intensity, group 3 moderate to intensity. So when can we give somebody low intensity? That will somebody ask. I didn't see where we give low intensity. Sometimes low intensity are just considered when a patient cannot tolerate any of these, especially with the old people. You say when they cannot tolerate the high and the moderate. So as a provider, if you start the patient on the high according to the guideline or the moderate according to the guideline, and patient cannot tolerate it, remember the side effect of statin is what we call rhabdomyolysis. So there are other things that can happen when you give them that high dose of statins. So when patient cannot tolerate it, you can give it to them. When there is any interaction, when somebody is elderly patient, so those are the reasons they may not tolerate it, or they have any liver problem. Remember, rhabdomyolysis can affect the liver. So another thing is that sometimes they can decide to start slowly, especially with the old people. They can start them slowly. So, but always remember that all this group of people we mention in summary, low intensity is not appropriate for them, except they cannot tolerate it. But to protect yourself and to protect your practice, don't give low intensity to any of those 4 groups. So that is summary. Low intensity statins are not recommended for any of those 4 groups that we mentioned, except you started them on it and they cannot tolerate it. Then you can now document, because everything is document. Because let's say you didn't, you started them on low intensity and patient develops stroke, they are going to look at the dosage of what they are getting. And if the dosage of what they are getting is very low, it's like the same thing when you talk about patients that have a vitamin D deficiency and you are giving them low dosage, and patient end up falling, fracturing one part of their body, and they are going to look at, okay, what dosage is this person getting? So it's always very important, especially with starting hypertensive medication, you need to make sure that patient is getting the right dose. So please remember the 4 group that we talked, and that is your statins benefit group. And anytime you are giving them statins, you need to monitor side effects of statins, because like you said, it's very high yield in the exam. Statins can cause rhabdomyolysis. It can cause those muscle ache, muscle soreness, fatigue, low energy. Those can be the side effects. And also remember, statins can also increase the liver enzymes. Then in rare condition, statins can also cause muscle pain, which we call rhabdomyolysis. So anytime you put your patient on statins, so let me include that here. Anytime you put your patient on statin, also make sure you are monitoring. Tell the patient, educate the patient. So that is the muscle pain and weakness, the dark colored urine, and sometimes it can also cause jaundice, abdominal pain, abdominal pain. And also they need to be able to report any muscle pain. I didn't say bone pain, I say muscle pain. And you can just use this mnemonic, which is the same mnemonic for statin, the name statin, to be able to remember the possible which is like sore muscles. So let me include that too. So you can use the letter statin to remember the side effects. So what are those side effects? Sore muscles, tiredness, the abdominal pain, transaminase elevation, increased blood sugar. Yes, it can increase the blood sugar, and memory problem. Okay, that is our statin. So statin is very important for the exam. It's one of the medication. I know this is GI, but it's still important that we're talking about it. So also it's important that we're talking about it. The frequently asked question in the exam, they will ask you a question: all of the following medication increases gout, except the answer is always statin. Statin are not known to increase uric acid. So aspirin is known, TB medication is known, ethambutol, pyrazinamide, we talked about it under pulmonology, TB medication. um but statin do not increase. So if you see, for example, which of the following medication does not increase uric acid, so it will be statin. And final thing that we always see in the exam is educate them to avoid grapefruit juice. So grapefruit. So uh, look out for more questions on statins, because it's very important.